Shalom from Jerusalem. This is Shalva Weil on ensuring safe societies through femicide prevention. What is femicide? It's the killing of women and girls because of their gender. It's not the arbitrary murder of women like in a robbery, but the murder of women by men because they are spouses, partners, and their female partners. This was a term coined by Diana Russell in 1976, and basically I revived it in 2013 when I was running European-funded big project called Femicide Across Europe. Femicide is a leading cause of premature death for women globally, distinct from homicide and other forms of gender violence. There are lots of questions which remain. Is femicide misogynistic? If a woman is killed by a female partner in a lesbian relationship, does this constitute femicide? And how old are girls who are killed? Is the murder of young female babies or children who are femicide, or only the murder of girls past menstruation who are then considered women? There's different terminology for femicide. In my day, it used to be uxoricide, the murder of one's wife. And there are different types of femicide too. One can murder one's mother, matricide, one's sister, soricide, an infant, infanticide, a fetus, feticide. And female geronticide, the murder of elderly women, is becoming very acute as life expectancy rises. Familicide is the murder of an entire family, unfortunately. There are different types of femicide. The most spoken about in the media is honor killings, supposed to be honorable, but they're very dishonorable. The sex selection before birth, like in China and in India. Dowry marriage murders, of which I've written about in India, and other forms of lethal violence. These different types raise the question, is femicide culture bound, or is it a universal pattern? 39% of all femicides are intimate partner killings. In high-income countries, this percentage can rise to 41%. Rates of femicide vary from year to year and from country to country. Femicide increases in some countries in Europe, like Switzerland, Slovenia, and Portugal, and remained stable in others, although high, like in France and Italy. In some countries, like Iceland, which admittedly have a low population, there are extremely low rates of femicide. Why? So, prevalence: 1 in 7 homicides, murders in the world are femicides. According to a UNODC report, 87,000 women were murdered in 2017 in 1 year. 50,000 of these knew the man who murdered them. 137 women are killed daily. Femicide is highest in the Southeast region, and it's lowest in the Western Pacific and in Eastern Mediterranean regions. As I said, the best global source on femicide is the UNODC report Note on Homicide. It shows that basically a woman in Africa has the greatest risk of being killed by an intimate partner or other family member. But still, femicide is still invisible. Many more femicides than those 87,000 are perpetrated globally. They're not recorded in villages in Africa or in South America or anywhere else in the globe. Papua New Guinea does not make a proper record of these killings. Researchers and activists often study unpleasant subjects. So maybe the reason could be that femicide is unpleasant to study, but there are many other insalubrious subjects like genocide, slavery, war, and abject social differentiation. It's time to take up femicide as a subject. The other reason why it may be invisible is that it may be a human rights issue. It's studied by lawyers, medical personnel, and criminologists. It's not in the scope of social sciences or practitioners. But it should be, and it could be studied like suicide is, and can be analyzed as a social fact using Durkheimian conceptual tools. Another reason that it hasn't been studied or dealt with until now is it pertains to women only. Traditionally, males have dominated the social world. Even feminist sociologists, who are quick to take up most issues pertaining to gender, still ignored and ignore the lethal killing of women and girls. To the best of my knowledge, this may be one of the first times that femicide per se, not violence against women, has been included in a gender summit, which purports to cover all subjects relevant to gender. I hope I'm wrong. Femicide is a legitimate study, subject to study, and we have to learn how to prevent it. It need not be relegated to the confines of radical feminist sociology or feminism alone. Another reason that it's been ignored is that the focus is somewhat fuzzy. So femicide has been associated with genocide, and even Diana Russell, who coined the term in the 70s, said that femicide is the most extreme form of genocide. I personally do not agree with that. Another reason is that femicide cannot be studied qualitatively, since dead people can't be interviewed or observed. But there can be qualitative studies of femicide, although they're scarce. Methodological solutions exist. Researchers can focus upon women, upon survivors, failed femicide attempts, or interview victims, kin, friends, neighbors, or perpetrators themselves in jail or in lunatic asylums. Finally, there's too much missing data to justify credible quantitative research into femicide, some people say. But we have to create this not just from official sources, but from media and from other reliable statistics. Added to this is, or allied to this, is that comparing femicide rates remains the ultimate challenge for researchers. So what databases exist on femicide and what do they do? There are global databases like World Health Organization, not on femicide, but on femicide-related topics, and the UNDC, as I've mentioned. There are continent-based observatories, and I myself had a hand in setting up the European Observatory on Femicide, but it's only beginning to gather data now. There are continent-based monitors on homicide, like the European Homicide Monitor, but it's on homicide. Femicide is part of it, but it's still on homicide. There are country-based femicide censuses, which gather non-standardized, non-unified data, non-comparable. And there are data collected by NGOs, and global media is often a very good source of information. Sometimes there are media databases, like in my country, the Haaretz has a media database. Scholars are only now beginning to coordinate comparative cross-national surveys of femicide based on available data. But these databases are out of date. There is no systematic annual collection of femicide data at all. The closest we can get is sometimes here and there they collect data on gender-related killings of women and girls. Some countries don't provide statistics at all. Others supply wrong ones, sometimes on purpose. The data is rarely disaggregated by gender. And even if it is, people don't disaggregate within gender for ethnic or racial groups, i.e., that is, there's no accountability for intersectionality. And they often come to conclusions about risk factors based on homicides, which are erroneous for women murdered because more men than women are killed globally, as we've just shown. And they ignore other femicide-related deaths, like the killing of children or mothers-in-law or bystanders at the scene of the crime. So how do we ensure safe societies for women? Women's lack physical security, and although this is an old map, it's very telling, because the darker the area, the more difficulty women have in ensuring their physical security. So what are our objectives here in the Gender Summit, or for the next 10 years? We have to launch a global effort to define and monitor femicide, to produce an articulated and common theoretical and interdisciplinary framework about femicide, to establish preliminary conditions for comparisons of data on femicide, both qualitative and quantitative, to establish coalitions on the prevention of femicide, bringing together practitioners, policymakers, advocacy groups, and researchers. We have to publish the recommendations for policymakers and monitor femicide in the future through the establishment of femicide watchers. And the UN Special Rapporteur on Violence Against Women has indeed called upon all the countries to set up femicide watchers. And then the objectives can be country-based. We have to beef up risk assessment teams, police and home guard training, increase laws to recognize femicide as a human rights crime. We have to do fake fatality reviews. We have to invest resources to enforce sanctions, to empower health personnel and to empower social workers and community advocates. We have to improve shelters, sanctuaries for women and men who are abusers. We have to enforce gun holding restrictions and this crazy situation where known abusers are in possession of arms. We have to increase use of technology and apps for prevention and educate from an early age to teach respect for women, whoever they are and wherever they are. So finally, how safe are we during COVID-19? We are not. Resources are being channeled towards fighting the pandemic and social and health services are being reduced. The UN has noticed that there is a spike in domestic violence reporting, but the closure of women's shelters in many countries has meant that women and children are now in daily fear of being murdered by their proven abuse partners at home. With greater isolation, women are less in touch with social networks and support groups, and helplessness is increasing. Violence against women is inextricably tied to issues of power and control. However much we imagine that the social order has changed and that there is more gender equality, the fact remains that this is still a male-dominated world dedicated to combating the virus, but not yet committed to eradicating another pandemic, femicide. So femicide is a pandemic just as lethal as the coronavirus, but it has become exacerbated during this pandemic. In the past decade, it has killed more people, that means women, than COVID-19 has to date targeted. We don't know what the future will be. But the World Health Organization has not recognized it as a pandemic. Femicide can be prevented through legal action, planning, policy changes, and education. It is time to include femicide in our agenda for sustainability in order to ensure the safety of our societies for future generations. Thank you very much.